icons and the process of using this, you'll see in your left-hand corner we have a list of all of the participants that are on the phone. Directly below that, there are a set of icons that while we're going through the presentation, if you have any questions, you can raise your hand. You just click on the hand icon, and then I will call upon you. And if I don't do so immediately, I will see it, and I will get to you when we're at a point that I can stop and answer your question. Below that, we have a chat area. You can see that there are some messages there, and again, I apologize for that, the one I put up initially. Directly below the area of the messages, you see a white rectangle box area. That is where you will enter your message, any question, whatever you have. And then directly below that, you're going to push the send. You'll see that it says to this room, or you can click the arrow and you can select specific participants. If you don't select a participant and you put your comment into this room, then everyone on the call can see your comment. Below that, we have the audio capabilities, and we will not be using that for the call. If you have clicked into that area, please go ahead and unclick your microphone. We're using the phone as our audio and do not need that portion of the webinar. So we will go ahead and get started, and I have the agenda on the screen now, and we will, as we go through the meeting, I will be bringing up all of the documents that are listed on the agenda. So at this point, I will go ahead and turn it over to Cecilia, and she's going to give you some a little bit of background on the purpose of the CDD profile and data collection.
Thank you, Patty, and good afternoon to each of you. I'm going to give a little bit of a background of why, in the midst of all of these program cuts that we've had to all of our projects, we're adding something new. So first of all, I'd say I know and acknowledge that everyone has, all of our quality improvement contracts have suffered contracts, but this was a process that I started actually 2 years ago. We engaged UC Berkeley Center for Childcare Workforce Study. I get the whole acronym mixed up, but anyway, it's with Marcy Whitebook and Fran Kipnis, and I asked for their review of all of our quality improvement annual reports, which also included the LPC information and AB 212 information. And what I was looking at was I wanted to be able to post on our website the effectiveness of all of our programs, to be able to demonstrate that to the legislature, who at times questions the use of those funds. And although we have had annual reports that we've been accepting for years and that are perfectly fine for how they're responding to the requirements of their given contracts, what their evaluation told us was that everybody is collecting information about their participants in a different way. It's not only that we're collecting apples and oranges, but we've also got some potatoes and rutabagas in there too, and so it's just not coming out in any kind of consistent way that we could explain to the legislature the impact of our quality improvement dollars on improving the workforce. And so their primary recommendation was that we initiate or instigate the use of a common registration form that anyone in the workforce who touched a quality improvement provider, trainer, received a stipend, those kinds of things, would provide us with information so that we collect that all in the same fashion. And so we said fine to that idea, and then also engage them for another year in the development of that common registration form. So last year, they were involved in developing that. There were several representatives from our quality improvement providers who participated in that and who also piloted it last year in like January, February, March, in that quarter of the year. And from that process, now, what you will see is it's a lengthy document. This is actually a trimmed version, and the first iteration had both the person who was the person you might say directly in the field, which we're calling the direct service provider, as well as what we're calling those who are providing support or services above that, which might be faculty, which might be yourselves, anyone who is not actually delivering care to a child. And we've actually also included that could be first grade teachers who want to find out, or kindergarten teachers who want to find out about what we're doing. But at any rate, those were all in one document, and we found that very confusing, and so now it's split into two documents. And although it seems extensive, and we'll go through that, the other thing we also did was identify that once you're in the system, you will be in the system, and there will only be the need then to identify, and what are you here for today, and the little cues that we're going to get for a unique identification of who that individual is. Other questions, which I know will come up today, but that were discussed in last year's pilot year, were concerns from individuals about presenting to the state or to the department information that could be perceived as being providing too much unique identification about them, with a fear for what that might be used and that kind of thing. We did an extensive work to really clarify that we're collecting only part of a Social Security number, not the entire Social Security number. It is larger than most because we're asking for 5 digits, not the last 4, but still enough to be unique. When Berkeley ran analysis for California to have their identifier only having 4 digits of the last 4 digits of the social, would actually have too many redundancies with birth dates and the last 4 because of the size of our population. And so we were advised to use the last 5. So those were things that were of concern, but and that went into our decision. And then in proceeding with this, to facilitate hopefully the ease of doing this, of course, doing anything for the first time isn't easy, and we know that, but we have it going through one contractor through the Child Development Training Consortium so that will facilitate the consistency of how that reporting is done, and so that you don't have to worry about collecting everything on everyone, because if they in fact have attended something else, they only need to do the short form, and you don't need to worry about it. If they've seen it before, it's just the short form. And so that's some of the background, and as the afternoon progresses, if I need to provide any further clarification, I'm happy to do that. But let's get down to the nitty-gritty, all right? So back to you, Patty.
Thank you, Cecilia. So I have brought up the first handout, which is the confidential profile for direct services for participants, and we're going to look at this together. You can see on the top of this there is a vendor organization code, and this has CDPC's vendor organization code. But I want to bring up the codes that Linda Parfit sent all of you a copy of this, so you could enter your own organization and vendor code. And these are the program numbers that you would use. You have your 4-digit vendor code number, and then your 4 8-digit program code number. And then there are types of trainings, and I will go back to the direct service form to show you where those go. So here are the 8-digit number, and again, that correlates to what we were looking at, your 4-digit vendor code number, 4-digit program code number, and then the title of the training would be related to what the training is, that is the training or the specific activity. Again, if it's a retention activity, financial support for training, or a stipend, that would be entered into this title of training. So then you will enter the date of the training, and you can see how we require that. It needs to be by 2-digit month, 2-digit day, and 4-digit year. And then Cecilia had talked about this a moment ago. The next section of this will require that they enter, this is for the participant now, the participant will enter their birth date, their city that they were born, which will be a tiebreaker in the event if we have two participants that have the same birth date and the same last 5 digits of their Social Security number, which we probably don't have a chance of that happening, but in the event it does, the city of birth will be the tiebreaker for that. Then we have the last 5 digits of their Social Security number. It is imperative that we get the birth date and Social Security number because this will create a unique identifying number for each of the training participants. As we progress through the year of collecting the information in our system, a participant file will be created by that unique identification number. So again, it's very important that we get this information and that it's accurate. So if you have a participant turn in a form to you and it has, or hopefully you're scanning these with them as they're submitting them, but if you see that it's a year of birth that you know could not be possible, if they've listed 1676 on it, you need to get an accurate birth date year from them. And again, this will just be part of the process of all of us getting familiar with this, and then too, the participants becoming familiar with these forms, because they will be completing these at all of the trainings or activities that they're participating in through the Child Development Division state-funded programs. For example, our students at the Community College program will be completing these, the mentor program, all of the PITC participants, all of quality improvement projects at Child Development Division will be submitting these forms. So you can see, and some of you were on the call last time, so this is a little bit redundant, but for those of you new, I want to just, again, go through the form and just familiarize you with it. Not each specific question, but just to show that we're collecting information about their education and some very specific questions about permit level, credential level. Then we have employment information. And again, it's just that they go through and answer these questions. And to the best of your ability, you make sure that they're completing all of them. Then we have, again, a lot of information about their employment and then their demographic information. The last question on the profile asks if the participant would be willing to have their information become part of a workforce registry pilot that is being developed through the San Francisco Human Service Agency and in conjunction with part of LA County. They have funding through the Packard Foundation, and they're going to be developing a registry pilot. So again, if your participants are comfortable with supplying this information, they can check yes, and they can be part of that pilot study. Again, it's not a mandate, but if they're comfortable with it, they can check off that box. On the agenda, I have listed, and let me pull that back up. You can see that handout 2 is a PDF version of the direct service profile form that we were just looking at. if you would need assistance after you know what number you need to put in for your vendor and program code and your title, if you would like, you could contact our office and we could create a PDF file that you could send out electronically to your participants. So that, I'm not going to bring that file up, but that is what we do have available if you so desire. We also have the direct service form in Spanish, and we're also able to assist you with developing a PDF, fillable, and savable form in Spanish. Again, if you're going to do the PDF, you want to make sure that in advance you put in your vendor and program organization code to make sure that this is accurate, so as it goes out into your trainings or into your organization that you do have that correct code on there. So, and then the same thing on handout number 4. That is a PDF of the Spanish version of the direct service form. So as we look at using the forms and gathering the data, it's really easy if you think about it, that it's a couple of steps. One is that you take either the direct service or the infrastructure form, which we're going to look at that in a moment, and then look at the distinction between those two forms. But as you start gathering this information, it's pretty simple, again, if you look at it in steps. First step is you have to decide if you're going to give your participants a direct service form or an infrastructure form. You need to make sure that you have the vendor code and organization code pre-printed on the form, so you make sure that that stays straight in your agency, that you know how to report it to us, which we'll look at that, again, the steps for that in a moment. And then, once the form is completed, then there's a data entry sheet that we're going to look at, that you enter that information onto this data file and then forward the Excel file to us. So it's really, it's complex thinking about the entire project and all of these 20 handouts that are listed on here. But if you look at it, that it's really very simple. We have to collect the form. You have to make sure that the information is accurate. It's most specifically that is pertinent to you. And then you have to get that information to us, the data. So again, we have the direct service form, the long version. That form is utilized by the providers in the field. Those are the people that are working with the children, working in the classrooms. The infrastructure form, the distinction between the direct service profile and the infrastructure profile, and let me bring the infrastructure profile up for you. The infrastructure form is utilized by the trainers. Would be utilized by the individuals that are actually conducting the training, utilized by faculty, just, again, the trainers. So you can see infrastructure for the organization participants, and then the direct service form is for the providers. So the infrastructure organization form is a little bit shorter. There are only 20 questions to that. And it basically has the same criteria of making sure that you include the pre-print, the vendor and organization code, the title of the training, and then the completion date of the training.
And only to interrupt briefly, but I don't envision that there would really be, that would happen too frequently for you to do, because under AB 212, the point of it is to pay for services for staff within child development contracted programs. So I would imagine that you're not likely to use the infrastructure form. And if you were, I'd probably want to know about that. But But right now, I don't think it's happening. And if it is likely, maybe someone can clue me in why that might happen. Okay, thank you.
Thank you, Cecilia. And then I would like to note, too, for each of the profile types, being the direct service or infrastructure, there is a short version of those forms. And let me bring up the direct service short form. This one, the purpose of the short form would be that, for example, we have a student completing the form, and then they go into AB 212. They've completed the form through CDTC, the comprehensive form, the 26 questions, and then they go into your organization and they apply for AB 212. Well, they can say to you, when you give them the confidential profile, that they have already completed that through CDTC. Then you would just give them this short form. The short form, again, the information specific to your training organization, the title of the training or the activity, such as the stipend, and then just those first three questions of their birth date, city of birth, and then their last 5 digits of the Social Security number. So this way, they don't have to continually to complete these forms as they go through the system, through all of the Child Development Division funded activities. If they say that they have completed it and they really haven't, then at some point we will be able to identify that on our end and then let you know that next time they're participating, we do need the entire form filled out. Another option would be that they have completed the long form, the 26-question form, and they've completed that with you or with one of the other CDD organizations, but they just need to update. So then they would complete the comprehensive form, the long form, and only make changes to any updates they had. Say that they've changed their employer type or just anything specific on that to them that would be a change on that form, then they would go in and make that change. So they will either have the direct service form, the long form, they will have the short form because they've already filled it out elsewhere and they do not have any changes, or they will complete the long form again and then answer only the questions that have any updates to them. And again, this is the first year that we're all doing this. It's the pilot year, so it's not going to be perfect, and we're going to just try and get as much information as we can, get the field acquainted to using this standard form, and we'll go from there. But again, just to give you all of the specifics of how that short form is used. And I see several questions here. I'm going to just see if I can go through, just pause for one moment. Yes, we will send out the code sheet. If you did not receive that, we'll send that out again through Linda. And we do have the forms available in Spanish. And at this point, that is the only language, Spanish and English, that we have them available.
Right. We're working on the Chinese one. So far, that's the only other one in development, and that would only be, again, for direct services.
And Cecilia, if you don't mind addressing this with the providing a series of professional development opportunities on same topic, do they fill out one for the series or short form for each time you meet with provider?
Okay, for this one, let me use an example. I'll use two different examples. When the Program for Infant Toddler Care meets with a program to do an extended bit of technical assistance, they have a beginning and an end. And in that case, when there is a beginning and an end, the end date is used. And so they only fill it out the one time, and that might be, in that case, something like 60 hours of technical assistance. but the other case I'll use is the California Preschool Instructional Network has a series of trainings on language and literacy and mathematics, but there's not an assurance that if those are open to the general public that everyone will attend the full series. And so in that case, they're doing the long form or the short form at every single one because they're not assured of a beginning and end. Another example would be the PITC institutes. They only do that at each of the institutes that have a set, but they'll do it again for modules. So 1 and 2, because it's at one time, is done at one, and then 3 and 4 is done at that second time because there's not an assurance that they're going to show up for that next set. So it depends on what that is. Now, in your instance, we've added a category for retention activities, and which one of the things that's very likely for you with your participants would be like professional growth advising. They might come in, you're providing professional growth advisement, and so that might be, you might do that just on a calendar year and just do it once. That covers that series of times that you're meeting with them, but we don't need to have it for like every half hour or every hour that you're meeting with people. We don't want to drive you nuts or them nuts. So you have to use your judgment about that. Remember, what we're really looking for is beginning to have a handle on the breadth of what we're doing with professional development, as well as who are our professional development dollars actually touching, contacting. Are we reaching all of the appropriate workforce, or are we leaving some areas out? So it's going to help us with some other decision making. But don't overburden yourself. Just try to make a logical process. For you, you might want to do them in some cases by semester, because that might be how you interface with people. So it might be by semester or it might be annually. And I would defer to you for how you interface with your clients.
Thank you. And Cecilia, before we go into the instructions for implementation, there is another question that from Kathy. We run AB 212 through our CARES Plus stipend program, where we already have a very long application process. We will be pulling the information for the AB 212 form from this larger application instead of having each participant fill out another form. Will this be a problem?
That's a good question. We worked with people when they were developing their database, and the questions, because we were already in the process of having this form developed. So they did work with Fran and with us on that process. So it should, I think the one difference, I think theirs might ask for the complete Social Security and number, and you would probably need it if you're actually making a payment. But for the piece that's submitted into this form, we only need the last 5. And I think they have a question also about birth, and it asks about country or something. And then it has a few other things that are a little different that meet of what they're trying to do. We don't go into that differentiation here. The only reason we're collecting city of birth is, as Patty mentioned, is as a tiebreaker, because we're not trying to also capture whether we need to look at international credentials or anything else. But for the most part, they should match up because we shared the same data dictionary. It should be collected even in the same fashion. So anything where it's asking the very same information, it should even be collected the very same way, because that's how they built their database.
Okay, thank you. So now we will go to the agenda. Again, we've gone through the direct service form, the long version, the direct service form, the short version, and the specific uses for that, the infrastructure organization form, and again, that has the same the long version and the short version. The infrastructure organization form was not developed in Spanish, it's only in English, figuring that the trainers are able to complete the English form. But again, you can see that we have those in Word doc, we have them in PDF in both the Spanish and English, and again, we can assist you with developing a PDF fillable with your specific vendor code and organization code if you would like. So again, you can contact Janelle, and we will have a contact sheet here in a few moments that we'll look at, so you'll have all of our contact information. So the next part we're going to go, the next part of the agenda is the implementation of the forms. And on handout, let me go ahead and get the handout open for this. We developed a very specific, again, with the steps of how to complete the form, which version of the profile would you select. We're recommending that you could color code those, and Cecilia did indicate that you probably will not be using the infrastructure very much, but if you are going to be using the infrastructure and the direct service, it may be helpful to color code those in your agency so you know which form is which. Because again, they are very similar except in the number of questions that are asked, and a little bit of a different content, but not too much. So again, we have the 4 versions of the participant profile. We have the profile for direct service participants, and it's used by participants who work primarily in a child care center, family child care home, or as an individual child care provider. We have the Spanish profile for the direct service participant, then the profile for the infrastructure organization, and this again is used by participants who work primarily in infrastructure organizations such as resource and referral, college, First 5, or so on and so forth, mentor and such. And then we have a shorter version of both forms. And again, these are available for participants if they have completed the form before, and whether it was a training delivered by your organization or through a different organization. And again, then we will, they would complete the shorter version. If they need to just update some items, they would complete the long version of the form and then just indicate those changes on the long version. Some more information about the entering the organization's vendor and organization code. And again, that was sent out to all of you. We will, Linda will send that out again after the call to make sure everyone has access to that. You need to make sure that we have the title of the training, the completion date of the training, and here is some more information about what Cecilia just talked about regarding the date. If the training is a one-time training, enter the date of the training. If it takes place over a series of trainings over time, enter the date of the last session. And then participants complete the form only once per training topic, not per session. So I hope that gives you some clarification on that. And again, these are for participants who are asked to, we ask them to fill out the form each time they attend a new CDE-sponsored quality improvement training topic. But again, they will not need to answer each question. This is for the update, the participant that needs to only update. And again, that would be filling in your information in the top of the vendor code and program code, and then the training date and the completion of questions 1 through 3. And again, then they would review the long form and update only the information that has had any change. And we give an example of that the person has earned a degree or has a new permit level since they last completed the form. And then again, completing the last question, the question regarding the participation in the registry, and that is at their own discretion. So those are the implementation steps, if you will, of completing the form. my next. And then we also developed a series of frequently asked questions that, and this was all sent out to you. If you did not receive that, if you can just send Janelle an email, and again, her information will be here in just a moment, her contact information, and she can send out any forms that you are missing, or then the implementation steps or the FAQ. Anything that you did not receive, we can get this information to you. So again, this is just some question about why are we asking for the birth date and last 5 digits of the Social Security, and again, using those items for a unique identifying number for each participant. So this just gives, I'm not going to read through all of this, but you can at your leisure. That, again, it gives you just more information about the process and the concept behind creating a unique identifying number. And more information on that. If you have any questions about why we're asking for wage, there's some information related to that. Again, it's good to read through this, so this will give you a response as participants ask you questions about the form and about the process. And again, more information about the direct service form and the infrastructure organization form and the distinction between those two. And then also, too, if they have completed the form through someone else, through another training. So if you don't have this, again, it's good to just read through this and just familiarize yourself more with the process, with the form, and then be prepared to answer questions from participants. So we have that available for you. Then the next item that we're going to look at on the agenda is the collection of data. We have, let me get this form open. We have a very specific, very detailed listing of, it's a data dictionary and data entry instructions for use with the direct service form and the infrastructure form. And we'll just look at the direct service form so we don't overwhelm you with all of these different versions of these forms. But you can see that at the top of this it has a header of question, definition, field name, field length, the data format, and data entry instructions. And if you go back and look at your direct service form, you can see that this goes through each section and each question of the form. So the first is your vendor and organization code. It gives you the definition of what that is. Again, it's the eight-digit code that is specific to each of the organizations, and the field name for that is the organization code, and again, we'll refer to that again in a moment in another document. But it tells you that needs to be 8, the field length is 8 digits, and it's a number field, and then the data entry instructions is type in the 8-digit pre-assigned vendor organization code. And then the first digit should appear even if it is a 0. So this goes through every single item on the direct service profile. You see the vendor organization, the title of the training, completion date of the training, the first question being the birth date. Again, it shows that it needs to have it's a 10-digit field, and that includes the 2 digits of the month, and then the /, 2 digits for the day, /, and then 4 digits for the year. And then again, it explains and gives you the data entry instructions. And now I'm going to pull up the data, which is this handout 17 on the agenda. These data instructions will guide you on how to complete the Excel document that you're going to be sending to CDTC. If you see again, we have this very, very detailed of it's an organization code, training name, training date, date of birth. You can see the correlation between that and the document that we just looked at, the data instructions. So you're going to take each one of your direct service profile forms and you're going to enter this information into a spreadsheet. So again, starting with the organization code, then the training name, date of the training, date of birth, and again, very specifically, the month, day, the year, the city of birth, the last 5 digits of the social, and then this, between the date of birth and the last 5 digits of the social, this will create your unique identifying number. And then you're going to look at your direct service profile form, and when you get to this section for the education, you're going to have to, if they've indicated no high school, then you put a 1 cell, a 2 for high school, 3 for AA, 4 for BA, so on and so forth. So you're going to have to actually enter that code in the Excel document. So the same thing for the question 5, the degree from the foreign country. 1 is yes, 2 is no, so you're going to actually enter the numeric code for that. And then straight through all of the questions that are asked on the form. I know this seems overwhelming, but I think as we all get accustomed to completing this and putting this on the Excel document, I think it will become more routine for everyone. And there is also, Cecilia, I'm not sure where we are exactly with the survey form.
The SurveyMonkey, Patty?
Yes. Do we have that completed?
If folks are interested in using SurveyMonkey, they can. We do have sort of a sample, and we're just connecting them with WestEd, who has created a SurveyMonkey version of this form, and then that way they can send it out to their participants electronically. They complete the SurveyMonkey, and then that information can go straight into Excel, so there wouldn't be the data entry piece.
Okay, and then
SurveyMonkey. And so we've just been sending the contact information. So if you need that, I can send that to you, Patty, and then you can send it out to folks. But there's a contact person at WestEd that can give them more information on using SurveyMonkey. It does require a paid SurveyMonkey subscription.
Okay. So that could be another option that you can actually, again, we'll send that contact information to you, but you could have your participants go online and complete the application through a SurveyMonkey, and then that will generate the Excel document for you. Because the Excel document is what you're going to send to us. So ideally, by the time when you actually finish the export file, it would be just a listing of all of your participants. And I know that several of you have a large number of those, but I'm hoping that you can either you use the SurveyMonkey, or you just have, if you have some other data system that you're using, you can incorporate these questions into it and then just extrapolate the information that we are collecting out of that. So if you need any assistance with that, if you feel like that the SurveyMonkey isn't a good option for you after you explore that, and you need some help with, looking at what you're already collecting and how you can just expand the information to include the CDD form, and then we can, help you to, again, just get that out of your data system, the information that we need, and onto this form. So each organization on a quarterly basis, and we have that, we'll pull that up here in a moment to show you the submission dates and contact information for that. But again, you will end up sending us an Excel file that will look like what we just went through, showing how you're going to code all of those responses for each of the questions, and that will be for each participant. And we've already started receiving them from other organizations, and they're getting a system in place, and it's working out pretty well for them. So again, if we can assist you in any way to get this system set up, because again, the participants are filling out the information, but the part that will be a little bit cumbersome will be actually getting this to be part of your routine of completing this Excel file. Let me go back and look at, make sure before I move on to the next piece. And we have the forms for the data dictionary and the instructions and all of that. Actually, I think at this point we will probably coordinate it with Linda and Aaron and just go ahead and send out another whole copy. If you have not received this before, it may have went to the director of your organization. So check with them, because perhaps they have the forms. But again, we can send them out to you also. And I just, actually, Aaron or Cecilia, this question, when we partner with CDE-funded programs like the California Director Teacher Mentor Program, PITC, or CPIN, do we need to collect forms on behalf of both sponsoring programs?
Okay, that's a great question. It has come up because in some cases you're using your AB 212 funds to, you might say, to expand the outreach of those programs. So it's actually extending the viability of those programs. So yes, you're going to, but each one has to do, okay, so let's step back here. I'm using different examples. Say if I'm the mentor program, and my mentor dollars were going to allow me to mentor to a certain number of individuals, whether we're talking directors or whichever, or classroom teachers. And with using AB 212, you're able to extend their outreach and to additional services. Then the mentor program would capture it on their side as if it were a fee for services, because it extends what their dollars could do. You would capture it on your side with providing, there's number 7 is financial support for training, and that's meaning that you were able to underwrite additional services. So, and then I'll use another, so yes, you are, but so that each one is getting credit for, you're getting credit for using AB 212 dollars, the mentors are getting credit for mentoring, even though they're talking about the very same individuals. Now I'll use another example. We have, supposing there is, CPIN is putting on a training, and they're able to partner with their AB 212 in their county, and that allows them to bring in a second trainer and be able to double the capacity of individuals they could train on that given day. So again, CPIN would cover what they would have been doing, and then they'll also capture the individuals that are what the extended dollars are able to do. As on their side, they're capturing something that's called fee for service. Not that it is, but it means that it's services beyond what they would have been able to do otherwise. Using that example where they were already doing something and you could have, you might say, a commingled set of people, some of whom are child development contracted staff at, say, California State preschool programs or our center-based programs or family childcare home networks. Anyway, they're in programs that you are responsible for providing retention services for. We're hoping that you know who those constituents are, who those parties are, and so within those, say that your services were able to, let's say it was something that they expanded the training from 50 people to 100, only because those are round numbers. Then you would look to see that and if you were paying, say, you were expanding the cost of half of whatever it was, then the first 50 of those individuals who are also child development contracted program staff, you would identify as individuals that you had provided financial support for training. Now, if that sounds confusing, we're also having those same conversations with CPIN and with the other programs so that they understand how it interfaces. But we want to give each program credit for what they're doing. And when you are involved in those negotiations or you have something coming up, I'm happy to walk people through that.
Thank you, Cecilia. And then we have a couple questions in regards to mailing the forms to CDTC, and you will not be mailing the profile forms, only the Excel spreadsheet with the data. And let me just make sure we don't have any other questions that have not been addressed. And again, we will be sending out the forms. And the forms, there's a question asking, are these forms to be filled out by only those participants who work in a CDE-funded program or all participants who attend the activities? And it is just for the CDE-funded program participants.
It's on AB 212 funding. The funding is specifically in statute for individuals who are in child development programs. So we recognize that. Again, when you're sponsoring, when you're providing the financial support for a training and the capacity exceeds your, I should say, I don't know, I don't want to throw stones at people and believe, I'm not trying to, but let's just supposing that I'm Enyo or Siskiyou or I don't know, or Trinity or whatever, and whatever I'm doing, the number of CDD staff are, the minimum participants at the training needs to be, say, at least 25, but there's only 10 child development staff, and so you still put it on, and other people come to that. That's great, and I think you would. The intention is to cover who you are reaching, and but I want to do is make clear that the intent of it is to acknowledge who are the AB 212 participants. We'd have to see if about a way to acknowledge that your training dollars were actually able to go broader than just child development participants. There's always the catch-22, but you don't want to have underserved your target population either. It's only to the extent to which, in serving them, the venue allows you to go broader than just the identified participants. Does that make it clear? So
I think so.
Right. But when you're if you're training But there are other trainings that are happening in the county that are put on by First Five, we're not capturing what other people are doing. As if I had one of the counties wanted to use the forms because they wanted to collect things in the same way. And that's actually a marvelous thing. Nationally, we're trying to be consistent about data collection and that kind of thing. And so if you're working with your colleagues in your county, that's fine, but we want to make it clear that the form that you see is always distinctive to quality improvement dollars that are being used for this function, so that if somebody else is collecting things in the same way, they can do that, but it can't be on the very same form, because I don't want to confuse people about that.
And there's another question that's kind of a follow-up to this. If we sponsor a training by CPEN and the participants complete CPEN's direct service participants form, then CPEN will report the person's data, not us, right? And that was the question, right?
And that answer is no, that's not correct. I just tried to use that as an example. If CPEN will identify who they have trained, because they're covering content, what you would be reporting is that you used your dollars, and you would use code number 7, that you financially supported the training. And so it might be the very same people that are reported under both entities for the same day. But it's not really double dipping. If CPEN were doing it with their own dollars, they wouldn't need your money. I would presume if you're sponsoring CPEN, just like you, they also got cut, and your funding is allowing them to extend their reach and go beyond what their own dollars could do. And they're going to be reporting it under a code that they have as fee-for-service. And that will help us to know to the extent to which their existing funding is not sufficient to cover the demand. So do you see how, in that case, both of you are doing it? You're reporting it as you've financed the project. They're reporting it as they provided the training. And that's it. When you have these combination ones, really, I have no problem with this. Through this year, you can contact me, Aaron, Linda. We'll be happy to work you through these, because this is the first year of attempting to do this, and it could be confusing because you think it's covered by somebody else. But what you want to be sure is that you don't get short. If CPEN only demonstrates it, that doesn't show that you have done anything to support it. And that's what we actually want to capture in this, is that you provided the financial resources to make that event happen.
And then a follow-up to that, what if both sponsors are providing content?
So you're telling me, and we will need to have a further conversation, that the LPC, you are now providing content, and if that's the case, we will have a larger discussion about your role.
Okay.
That's a big issue.
And then we have a couple questions related to submitting the forms and the address and such, and then the data file, and you will have clarification on that in a moment. We have a sheet that has the Janelle's email address, and we will look at that. But then there's also a question, if we duplicate a participant's info because we did not know that they had completed a form elsewhere, does this cause a problem when the data is uploaded? And no, it does not. Again, this is our pilot year. We're just trying to make the best of it and see, again, with a pilot, you're trying to see what the outcomes will be and such. So, no, it will not cause a problem. Let's see.
Patty, To the question that I responded with LPCs providing training, I would really like to have either some feedback at some point, possibly not for the webinar. When you're providing training, if you're again paying for other content, I don't know, somebody to come in and present information about class or that's again paying for content and providing training. If you're saying that LPCs are providing training, it is a large issue, and I will probably want to have a further discussion about that taking place. But if you're providing multiple kinds of training, that's not a problem. One of whom just might happen to be one of the quality improvement providers, but the others could be. If you've got Robert Pianta out here, that's great, and you're paying for him to come out and provide training, that's fine and dandy.
Thank you. And then again, a question in relation to the filling out the Excel sheet. If someone does not answer a question, do we just leave the field blank? And yes, you just leave the field blank on the Excel form.
I've got a few questions, and I see one up there, if you don't mind me, Patty, because let me go through we have planned for 3 codes for LPCs to use. The first code is, they all are 3 digits LPC, so we can all identify that it's coming from the LPC. That's pretty straightforward. And then there are 3 other numbers. One is a 0, and that's when you're providing retention services. And that could be, like I used the example, when you're providing professional growth advising, when you're doing transcript review, anything that promotes the broad term of retention activities. The second one is, which I've already referenced, is number 7, and that's when you provided financial support for training, and that could include paying for substitutes so that people could go and attend that. So they're going and attending, and what you're doing is you're providing the release time for that person to go and attend. That comes under that financial support that facilitates training. So it can be anything that falls under that umbrella. And then the last one is number 9, so LPC 9, and that's when you provide a stipend for somebody, say, who's completed, so many units and they get a stipend of so much, or they've gotten their degree and they get a stipend for so much, or it's a reimbursement. You're reimbursing for books or for the cost of the course, anything that falls under a reimbursement or a stipend that goes to an AB 212 participant. So generally, 0 and 1 match with participants. The 7 matches with participants in sort of a roundabout way. Which were the people that you provided financial support? So you provided a substitute for Susie Q, or you provided that kind of thing.
And then there's a question related to that, Cecilia. If we are working with participants in a professional growth advising capacity or permit application who may eventually be receiving an AB 212 stipend, do we consider this a retention activity 0 or stipend 9? Good question again. The work that retention work is anything that you're doing with the individual and whereas the AB 212 stipend is actually dollars going to the individual. So you can think of 0 as your work with a person, and the 9 always implies that there were dollars going to that person. Thank you. And for clarification, only folks working in CDE, CDD contracted programs are completing the form. Does this include family child care providers participating in family child care home education networks? What about folks working in centers that serve some children subsidized through CDE, CDD dollars?
the AB 212 legislation provides retention services and compensation for individuals employed in child development contracted programs, which would include family childcare home education networks. The only exception in what it might be to others is also in statute, and that's for family childcare homes in Los Angeles. There is no other exception to that statute. And as I said, if you're providing a training, like whether it's in Trinity or whatever else, and you're providing funding for the training, and it's to our child development contracted staff, and the capacity allows the capacity to be broader than just that limited population. You know, the room has a capacity for 50, and there's only 25, so you have another 25 come in. In that case, you could capture it for that purpose, but the funds are not directed to non-CDD staff. And the exception I'm making is only when the capacity for which you provided funding exceeds just those participants.
And then another question, so if state preschool is sending teachers to the CPIN meeting, then has to pay for sub, state preschool could count this?
If you're paying for if they've negotiated with the LPC to use those monies, with you to use those monies to pay for the substitute, if that's how you've written your plan, that's a legitimate use of your dollars, is financial support that supports retention services.
And then another comment. We provide trainings for our CDE staff and open the trainings to non-CDE staff to fill to training capacity. I'm hearing that we should capture the info on non-CDE staff who attend and benefit from this training, correct?
I think that would be to your benefit to acknowledge the scope of your dollars. But that's the only instance when you would be capturing information about non-CDD contracted staff employees. Yeah, it should never be for retention. It should never be for any retention services. It should never be for a stipend or reimbursement. It should never be for transcript review. It should never be for substitutes. That's the only instance I can imagine being legitimate, is when the capacity of what you're underwriting exceeds the CDD staff that would be attending.
And would they put the non-CDE staff information on their data Excel document?
If you want to get credit for it, right, that's the point.
Okay. And then a comment along those same lines. I'm doing the same as Carol, the last question. I'm the one providing the training in a series of workshops and some individual coaching. At my last training, I coded the forms LPC 1 because I didn't think options 0, 7, or 9 applied. Did I do this incorrectly?
I will be, the LPC contracts and the AB 212 contracts are now under my review under the Quality Improvement Plan, which will include review of your AB 212 plans. And so that might call into question that service as part of what the intention of the AB 212 funds are.
Thank you. And if AB 212 stipends are distributed in increments quarterly, do participants have to fill in a profile form each time they receive a stipend?
Right. If you're doing it quarterly, then I would suggest yes on a quarterly basis, because it could mean that on a given quarter they don't receive that, or they could have discontinued employment, and if you were waiting to do it 6 months later, you might have missed that person who is no longer employed. Maybe I'm off track there, but generally I would think for your services it would be at least semi-annually, but it could be quarterly. It depends on how you operate.
And if I'm providing individual coaching and at the completion of the coaching series, the participants receive a stipend, do we use both code 0 and 0 on the same form? Oops. Or actually, she said 0 and 9 on the same form. Clarified that. So if they're providing individual coaching at the completion of the series, they receive a stipend, do we use both code 0 and 9 on the same form?
You're going to acknowledge that service was performed over that period of time. That's a separate thing, and then a separate one to acknowledge that on top of that, receiving that service, they also received a stipend.
Okay, thank you. Thank you, Cecilia. I think we've gone through all of the questions. Again, I didn't address them individually if it was related to how to access the forms or where to send the data export files, because we will give you that information. So we're going to go ahead at this juncture, go ahead and look at the, actually the submission dates and contact information. Let me pull that up. And again, we will make sure that you have this information. Actually, we extended this to the end of the quarter, and I just realized we didn't put the correct form. But we will make sure that everyone has this. So again, we have the first quarter, July through September, and it is at the end of the month on all of these due dates. So it would be October, well, ideally this week, next week, as soon as you could get that information to us. And then each subsequent quarter will also be at the end of the month. But we will update this form and send this out to all of you. So as you're getting ready to send in the Excel export file, you want to email that to us. A couple people had commented on actually sending it hard copy through the through U.S. Post Office, but we would prefer that you email that. And the reason being is that will make it easier for us to upload that information into our database. Before you send the Excel file, if you could just review that and make sure that you've identified any obvious errors or corrections or exceptions on the data. Again, if you see a birth date that is 1964 for the year, we know that there's an error on that. And if you're not able to correct it, if you can just enter the zeros for that. So if you have the day, the month and the day, and then you know that the year is incorrect, just put zeros for the year. So again, if you can just look as closely as possible. And then again, I'm Patty Scoggins, the director, and I have my email address and phone. And then Janelle Dornaball. Janelle is on the phone. She is the first contact here in the office, and she's our administrative specialist. And we have her email and phone number. So again, I'm going to just go ahead and pull up the data entry template again, and just have us look at that together. And again, I know this seems overwhelming, but once we get a system in place, I think it will just get routine. And, you know, if you can even set up a database that you could start it with having your participant ID for everyone, and you could pull that information up as you, for that person to just update their file or have it that they would be, you know, say for an example, here's this participant ID, and then you would have another space for them and then enter the new information of the training. And again, if all of this is still the same and there haven't been any changes, then you could just assume that it's the same and it would be the same in our database. So there are some ways that you can think about doing this, setting this up where it will be as streamlined as possible for you. And then again, if Janelle or I can be of any assistance to you, don't hesitate to contact us. Now I want to see, we have a couple other questions. Let me make sure we address these. If we don't collect data until the third quarter, should we send blank forms for the first and second quarters? You don't need to necessarily send blank forms, but if you could send Janelle an email and just report to her that you do not have any data for this quarter, just so it keeps us on track and we know that we haven't, that you didn't forget or that we overlooked your email. And what if we already provided support for a CPIN training and did not have our forms completed? At this point, we're just moving forward. So if you have that information the next quarter, if you have your participants completed, and they're the same participants and you could have them complete for the first quarter, then we could do that. But if not, at this juncture, we'll just move forward and start collecting them.
Patty, to that, I want to just remind people that this last year was a pilot with just a very small number of programs doing this. And so we recognize that, in a sense, this first year of really implementing it is we're going to be getting data, but it won't be really as solid as it will be over time. But it's at least an attempt to begin to get this and to pull it together. And we will actually begin to get some information on the workforce from this. But we recognize that this first year is a little bit touch and go as people, begin to utilize it, and we have developed some consistency with this. So to the extent to which we can get good data, that's always good. But we recognize that it might not be quite so perfect this first year.
And then we will go through and write responses to the questions and then get those out to you also. So if, as you start working through this, if you have any, if we've answered some of your questions through this call, then you'll have access to them. See, I want to make sure that we've answered everyone's question. I tried to be very careful as I went through the list of those. Oh, actually, I apologize. We have one more item on the agenda, and we had this from our last meeting, Cecilia, that we had some specific questions that were asked in advance, and at this point, if we want to look at those again.
Okay, I think we hit most of these. So I'm going to go through the questions that were submitted ahead of time. At which trainings would these forms be distributed? And they would be distributed not likely at trainings unless you are underwriting those trainings. It would be when you are supporting the participant. So. And the other sub-question to that, any training in our county regardless of the training sponsor? No, we're not collecting, something that's sponsored by your local First Five or something else. It's really what what we're interested with these forms are those that are supported with the quality improvement dollars, and for you specifically with your AB 212 dollars. Second question is, will CPIN and other quality improvement professional development agencies be using this form? Yes, everyone is. Our ones that we are still working on are all of the resource and referral agencies, but our other sort of large contracts where we have a single source, they're clearly all on board, like Family Childcare at its best, the mentor program, program for the Toddler Care California Preschool Instructional Network, the Child Care Initiative Project, which is through the R&Rs, that one is. So all of those that we have a single point of contact with through each of their systems, that's definitely happening. And then sometimes CPIN or First Five might sponsor a training, but because a host, for example, the LPC is needed, it's subsidized by AB 212 or the LPC. Well, to the extent to which you're using your LPC dollars with it, that doesn't actually come under the umbrella. But to the extent to which you're using AB 212 dollars, that would come under that. And then you're going to have to do a little bit of math, a little bit of arithmetic to try to figure out what percentage did you contribute. Was your underwriting like for 1/10 of it or whatever, and then you capture at least of those participants, hope that 1/10 of them are child development contracted programs, so that you can capture them. And so even if they exceeded that, the ones that your money would be just the portion of child development contracted program staff that money paid for. And the third one is, how do you define AB 212 participants? And they ask the question, those employed in CDD-funded programs only. Yes, because, again, that goes back to what the statute is saying. It's not the extent to which state dollars go into, say, paying for a voucher, because that doesn't actually pay for a staff person. That's really a subsidy to the family. Any early childhood educator a provider, including CARES Plus participants that attends the training. And no, we're only capturing the extent to which your funds reach that. I would imagine that AB 212, that CARES Plus is capturing who are their CARES Plus participants. And then how do we use these at CARES Plus trainings as well, or do we use these at CARES Plus training? If your money, again, was underwriting some of that, then you have to capture it and try to figure out which of those are, in fact, your target population. But otherwise, you don't.
Thank you, Cecilia. And then just before I go to the group for any other questions, just a recap. Again, you're going to identify if the type of form that you utilize is a direct service form or an infrastructure form. The direct service form is for participants who work primarily in child care center, family child care home, or as an individual child care provider. The infrastructure form is used for participants who work primarily in an organization such as resource and referral agency, college, First Five, elementary school teacher, mentor, consultant, or coach. And then you need to determine if they're going to complete the long version of the form, which means this is the first time that they've completed it in your organization or any of the other organizations, and they would complete the long version. If they have already completed it with you, or they say that I've completed this with another organization, then they complete the short version of the form. If they've completed the form before and they want to only update some specific items, then they complete the long version, and then they only update the questions that are specific to their change. So again, direct service form, infrastructure form, either the long version or the short version of the form. You want to make sure that you have, let's bring the form up here real quick. You want to make sure that you have pre-printed on the form your vendor and organization code, your title of your training, and the date of your training. And then you can hand them out to them as hard copy. If you want to do some type of a electronic version with them and do a PDF, and you need assistance in setting up a fillable, savable PDF, again, specific to you with your vendor and organization code, CDTC can assist you with that. If you're interested in developing a Survey Monkey where you would give your participants the information, they would go online and fill out the information, and then it would generate the Excel document for you. Erin and Linda have information specific to that. CDD is assisting folks to get that Survey Monkey set up. There is a fee associated with that. I think it's a nominal fee to set up a Survey Monkey account. So again, there are the forms. The questions are pretty straightforward. You want to make sure that the information in the first 3 questions is completed in its entirety and that the information is accurate. Again, we talked about the birth date, the birth year. If you see 1684 on there, you know that it is not a correct year. And if you have access to the participants still and can get that correct information, then it would be helpful. We need their last 5 digits of their Social Security number. And then all of the other questions on the form are very self-explanatory for the participant to go in and complete the information. We provided a copy of a frequently asked questions that you can refer to see if, again, questions that the field may ask of you and you would have a response to that. Then we also have an instruction for using the 2 sets of profile forms, and that was provided. And then the next piece of this is taking the information from the forms and actually entering it into the Excel export file, which we will give to you. Those have been sent out, but we'll make sure that everybody has access to those. And I know several of you have asked about obtaining those. Now, we did send those out to the director of all of the LPCs. So if you don't have a copy of it and you're not the director, you might want to check with them just so they're aware of it and they know that you have the form and you will be completing the data Excel file, because we want to make sure we don't get this from a couple different people from your agency, which I doubt that you'll have time to complete 2 of them. So that's the process. And then once you complete the Excel file, then you will send it to the CDTC, and again, we will make sure that you have the email address and contact information. And that is on this form here that we will make sure that you have access to. So again, getting the forms out to the participants, having them complete them, bringing them back into your organization, and getting those data fields on that export file, and then emailing it to the CDTC. So with that, do we have any other questions? Let me make sure that and Janelle just handed me a note. If you did not RSVP to her, then she cannot send you the forms. So you will need to, and here's Janelle's email address. If you can send this to her and request that it be sent to you specifically, because again, we are using Linda Parfit's list of the directors for the LPC program. So you may not be the person that we have sent it to, but again, we can, if you email Janelle, we can send that to you. There is, let's see, a couple more questions. We are only AB 212. Why are only AB 212 activities being captured and not other LPC activities? Isn't it all paid for with quality dollars? I will defer to Cecilia.
Oh, thank you. At this point, when we think of the function of local planning councils in terms of, say, helping to remediate, city or planning code kinds of things, there are a number of activities that fall under planning, the needs assessment, and so on. This is capturing those programs, and in the state plan, the LPC shows up in terms of planning and coordination, whereas AB 212 shows up under compensation and other initiatives on that vein. So it's really because we're capturing with this form professional development activities and things in that nature. So it's true, it's not capturing all of the quality improvement dollars, like we're not capturing with this other activities that relate to, I'm trying to think of, the majority really fall under those two categories. But I'll use another example. In this past, well, now we're into 2 years, we have initiated an inclusion and behavior consultation network. And we're actually not capturing their consultations under this because it doesn't show up as actually a training, but it is providing technical assistance. So we're actually slicing things pretty prescriptively. So, and there are other kinds of efforts that don't actually show up as professional development and training activities.
And then we have another comment on that. As the LPC, we provide other activities, resources, professional development. For example, convening state-funded programs to provide ongoing support, resources, AB 212 program information, etc.
The AB 212, when you're doing that, that can fall under that retention activities kinds of things, because they're informing them how to access those services. As I get more familiar with those plans, I can see whether there needs to be any other modification about that. But that's not the intent at this point. But what I hear you saying is that because we've used the label in the code of LPC, you might want to be, or we might want to consider at some point, other dollars besides AB 212 sponsored things that fall under both the retention activities and the financial support. So we'll have to take that under advisement. That was not the plan from the beginning. It was really to capture those things that, from the state plan's perspective, show up as professional development related activities.
And another question, at what point is an AB 212 eligible participant categorized as a stipend code?
When you make a payment to that individual as a stipend, as a reimbursement for books, materials, and so on. When you're making a payment to the individual.
Thank you. So have we covered all of the questions? And if you, after the call, if you do have other questions, you can send those to Janelle and we will get a response to you. In addition, if you want to request forms, I've provided Janelle's email address again, and then we will coordinate efforts with Linda to send all of the the directors packet of forms again, and then make sure that that they have access to them. But if you want them as well, we can send them. But again, I do just caution all of us that we make sure we're not getting duplicative information from agencies. And let's see, before we go, a new question. Does there need to be a new long form for each person using a new code? For example, one person but codes LPC 0, 7, and 9.
Right, no, because that differentiates what's happening. No, you just need the long form. Whatever is the first time they've ever seen the long form, they should hopefully not even be paying too much attention to those top few little ones that you fill in. It's really whether they filled in those other questions that start with 1 for them.
Okay. One more opportunity for questions, and then I think that this will conclude our training on this, and then we will again be available for assistance. And Linda is also available for assistance with you on this. So again, this is the pilot year. We're just putting our best foot forward, making every effort to get as accurate information as possible. And as we work through this year, we'll be able to identify some of the strengths of what we've been doing, and then make some changes on some of the processes that didn't work as well. So I thank you, and again, we're available for support. We'll make sure you get the information that you need, and then we look forward to receiving your first data. And on that, too, we will send some direction, too, to make sure that you put the contact information from your organization. As we receive the data Excel import file, then we will know who to contact, but we'll send some information on that. So that concludes my part of it, and Cecilia, if you had any closing comments.
Just to say thank you, and I'm looking forward to seeing what we actually can roll up from all of this information. I think it will be really very helpful information and inform us all. We have that there is the annual report that goes to the legislature, but I'm hoping that this will give us some more robust information to really inform us about what's happening. So thank you very much.
Thank you.